Chief Minister Conrad K Sangma on Tuesday launched the Zoonotic Vector-Borne Diseases Research and Training Center at Indian Institute of Public Health, Pasteur Hill Shillong. The launch was also a part of a seminar on One Health. Addressing the gathering, Chief Minister Conrad K Sangma said that research is key and the information collected will help assist the policy makers to assess, make policy, and take preventive steps. He said an ecosystem should be created to take the institute to a new level, create opportunity, create jobs and research. He said the government is also examining the proposal to upgrade the IIPH. He said he looks forward to working more closely with the IIPH.
Nice and exciting and really, I should say, motivating to be out here today amongst all of you. The kind of thought process and the kind of approach that this entire One Health program and policy and thought process is having is really the way to approach any issue or any problem that we have. Sometimes we see that in society, in government, and in different programs, we have too many sectors and too many departments that are working. And sometimes because of that, we actually forget what we are working for. We end up doing so many things because we try to meet our deadlines and our guidelines and different programs, and forget that at the end of the day, it is the purpose that really matters. Here, it is the health that really matters. I was just sharing with Sampath that this is kind of an approach that we had for the maternal mortality rate in our state, because we started by having the issue of institutional delivery being maybe looked at one of the reasons why we have high maternal mortality. But then we realized that this is linked not just to the health facilities that are available, but it is also linked to the different economic activities that the women have, access to in rural areas, and different aspects of social issues that are there in our society, which are also affecting the maternal mortality. And of course, the basic facilities that we can give at the grassroots level, to our mothers. And you'll be happy to know that once we started following this holistic approach and looking at the problem from a larger perspective and not just focusing on certain numbers, we actually today, I remember the numbers because I just read it this morning, that India's national average in 2019 was 113. That is the maternal mortality rate. And Meghalaya in the year 2019, we were at 220 or 200 plus. We don't have the exact number, but it was 200 plus. And today, in a matter of 3 years from when we started this program of having this holistic approach, India's the national average today is still 113 in maternal mortality, but Meghalaya has now today dropped from 200 plus to 120. So we are almost at the national average now, which again is not that it's satisfying at all, but at least we are seeing the right direction in which we are moving. And why this is happening is because we have changed the way we look at problems. We have changed the way we look at an issue. We have changed the way we approach to the solution of the issue. And that is why what this One Health program that we're having is precisely that. You need to make sure that you look at an issue and a problem holistically. And I saw that entire presentation from the principal scientific advisor to the Prime Minister's office. And we could see that there were more than about 15 or 16 departments that were part of the whole process. There were almost close to, different, about 10, 15 different processes that need to be followed. And I think this entire approach is something that is really required in today's world. We just heard a live example that Kong Amprin had given regarding her own